Imagine a world without anesthesia or antiseptic where surgery meant facing pain and infection head-on. Now, picture a surgeon in ancient Egypt, bronze drill in hand, preparing to open a human skull. This was not a desperate act, but a calculated procedure by skilled individuals. The Egyptians, masters of mummification, were also pioneers of brain surgery. Evidence of their audacity is carved into the bones of those who lived and died along the Nile. Why risk such a terrifying ordeal? Severe injury, unbearable pressure, or perhaps a spiritual crisis could drive someone to the operating table. These were not butchers but priest-doctors, healers who blended science and magic. For them, medicine and prayer were inseparable. Every healing act was a sacred ritual. When a priest-doctor picked up their tools, they became a channel for divine power, restoring balance within the body. This sacred authority gave them the courage to attempt the unthinkable, cutting into the living brain. We often see Egyptians as obsessed with death, but their surgical feats reveal a profound commitment to preserving life. They faced the ultimate frontier of the human body with a mix of faith and practical skill. The real question is not just how they did it, but how many survived. The answer is written in bone. Their story is one of daring, faith, and a relentless pursuit of healing. The legacy of their courage still echoes through time. Archaeologists have uncovered the most compelling evidence of ancient surgery: human skulls marked with precise circular holes. These are not battle wounds but signs of trepanation, the ancient art of drilling into the skull. The edges are smooth and beveled, showing careful, skilled hands at work. But the most astonishing detail is the new bone growth around many of these holes. This means the patients survived, sometimes for years, after their surgery. These survivors were living miracles, proof of a medical skill we once thought impossible for their time. The reasons for such extreme measures varied: head injuries, epilepsy, or perhaps the belief in releasing evil spirits. Whatever the cause, the outcome is clear: people lived. The Skulls of Saqqara shout of forgotten surgical expertise. Each healed skull is a testament to resilience and the power of ancient medicine. These operations were not crude or desperate, but deliberate and often successful. The evidence forces us to rethink what we know about ancient healthcare. The Egyptians were not just builders of monuments but healers of bodies. Their legacy is etched in bone, challenging our assumptions about the past. The story of these skulls is a story of survival against all odds. The Egyptian surgeon's toolkit was simple but effective: bronze knives, saws, and the ingenious bow drill. The bow drill, powered by a string and bow, allowed for controlled, precise cutting into the skull. For delicate work, they used obsidian blades, sharper than any metal. Surgery was not just mechanical, it was a ritual, with prayers to gods like Sekhmet for protection. Pain relief was minimal, perhaps a herbal potion, but mostly the patient was held down, fully conscious. Survival depended on the surgeon's skill and the antiseptic properties of honey and linen, blending science and spirituality in every act. For centuries, our only clues were silent skulls, until the discovery of the Edwin Papyrus. Dating to 1600 BC, it's the world's oldest surgical text, filled with case studies and clinical observations. The papyrus details 48 trauma cases, each with examination, diagnosis, and prognosis. It even categorizes cases treatable, manageable, or hopeless, showing a physician who knew their limits. Most remarkably, it describes the brain, its membranes, and the effects of injury, centuries ahead of its time. Unlike other texts, it's almost free of magic, focusing on observation and practical treatment. The papyrus recommends probing wounds, checking pulses, and closing injuries with sutures and honey. Reading it, we glimpse the mind of an ancient doctor, methodical, empirical, and deeply curious. It's a direct link to a forgotten era of scientific medicine. The Edwin Smith Papyrus is a window into ancient genius. The knowledge in the Edwin Smith Papyrus was the peak of ancient medical achievement. But as Egypt declined, its libraries and centers of learning fell into ruin. Greek and later Roman influences overshadowed Egyptian methods, and much was lost or dismissed. The destruction of the Library of Alexandria erased countless scrolls, including medical wisdom. Europe's Dark Ages replaced science with superstition, and Egyptian surgical skill faded into myth. Trepanned skulls were rediscovered but misunderstood as ritual or violence. The true story of ancient surgery was forgotten for centuries. Knowledge, it turns out, is fragile, a flame easily extinguished by the winds of history. Step into a modern neurosurgery unit. Bright lights, advanced tools, and a surgeon guided by technology. Yet, the goal remains unchanged: to open the skull and heal what's inside. Today's surgeons have maps of the brain, anesthesia, and antibiotics, but the challenge is still immense. The courage of patient and doctor links us to the ancient Egyptians. The priest-doctor with a bronze drill and the modern surgeon with a gamma knife are part of the same story. We marvel at ancient pyramids and medical texts, still searching for their secrets. What other knowledge lies buried, waiting to be rediscovered? The story of Egyptian brain surgery reminds us, the pursuit of healing is timeless. Ancient wisdom and modern science are chapters in the same human journey. What else did the ancients know that we have yet to uncover?